So you are here for cleaning and disinfection, a deep dive for environmental service personnel. This is part one of a two-part series. We are doing part one today at noon. You're here. And then we're doing part two on Thursday at noon, the 29th. Today is going to be about 45 minutes-ish, and Thursday is a little bit longer. It's probably 45 minutes to an hour. So we look forward to seeing you for part two if you're here today, as well as welcoming others if they couldn't attend today for Thursday. You don't need to attend one to be able to attend the other. Quickly, I just wanted to take a moment to go over our continuing education criteria for those of you who are attending to receive CNE credits. So this is approved for a 1 hour or 1 credit course by the Nursing Continuing Professional Development Activity by the Northeast Multi-State Division Education Unit as an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. So in order to receive your CNE credits, you must complete the 4 steps. Step 1, you do need to complete that pre-session survey that I've mentioned a few times. Abby can add it to the chat one more time if you do need that. Second step is to attend the live training. After the live training, you must complete the post-session survey. It will be emailed to you tomorrow. So please take note that this is a different post-session survey than you'll take at the end of this session. The end of session poll is just a quick little poll, but you'll get an email with the survey tomorrow. Fill that out. And then if you are looking to obtain the CNA credits, you need to take that extra step and go ahead and take a post-session quiz, which will be emailed to you tomorrow as well. For certificates of training, EMS continuing education, and dental IPC continuing education, you do have to do 1 through 3, but then that 4th step, the post-session quiz, is optional. So if you do have any questions about any of this, we'd be happy to help you. You can email us, or you can put some questions in the chat if you have any difficulties, or have any questions now about it. So I would like to thank our Project Firstline partners, particularly the COVID prevention field team. So this course was a collaboration with the COVID prevention field team. So they had gone out to a few facilities within Rhode Island, observed some common trends and needs for education in a few areas within environmental services. So this first session today is a bit more basic, starting with general principles like hand hygiene, among some other things. And I know you may be thinking, okay, like I know how to wash my hands, but more so, when is it indicated, and with what? With soap, with sanitizer. So it gets into a little more depth there. And again, this is something that CPFT, when they were out in facilities, was frequently seeing as a room for improvement. So this is something that we know we need a little bit more education on. The next session, part 2, on Thursday, we'll touch more on actual cleaning disinfection process and important features of an EVS program. So I do believe the CPFT is such a great resource. It originated with the COVID-19 pandemic and has proven to be a valuable asset to the Department of Health and a resource to our communities. I would like to read you their bio and put in a plug for them, because if anyone is interested in having CPFT come out to your facility, it, again, is a really great resource. It's non-punitive. They just come out and they help you with whatever you may need. So the CPFT is a non-regulatory Rhode Island Department of Health resource for congregate settings and community organizations. The field team assists facilities in implementing effective on-site mitigation measures in response to outbreaks of COVID-19 and other infectious diseases. Recognizing the importance of supporting staff education and training, the CPFT also provides free on-site visits to assist congregate settings in preparing for and responding to infectious disease threats. This includes improving baseline infection prevention and education. Our goal is to improve the knowledge base, confidence, and competence of staff, leadership, and community members. So if you do feel as though your facility would benefit from either preparation, education, and training, or outbreak assistance, please reach out to the CPFT via the link that we will put in the chat. It's a bit link. Abby, I'm not sure if you have that. Otherwise, I can add that right at the end to the chat. And again, this is a fantastic non-regulatory resource for facilities. So again, welcome. My name is Allison Thurber, and I am a public health nurse at the Rhode Island Department of Health and a training liaison for Project Firstline Rhode Island. I will be hosting today's webinar, EVS Deep Dive Part 1, and this is a 45-minute interactive session. Please feel free, if you have any questions, to place them in the Q&A box, either above or below in the navigation, depending on how you have your Zoom set up. We do have some time set aside at the end of the session to answer all of your questions after this webinar. Again, like I said, the second session, part 2, will speak more to how to clean and disinfect, as well as the key components to an environmental service infection control and prevention program in your facility. So that'll be Thursday, the 29th, again at noon. And then lastly, here, the chat box can be used to introduce yourselves, where you're from, reply to interactive slides, and communicate with fellow attendees and our team. And again, that's either above or below in the navigation on your screen. We will be placing some links and resources in the chat box as the webinar moves along. But if you do miss them, don't worry, because we do send out a post-session resource sheet that includes all the links from today's session. So today's agenda includes introductions and learning objectives. We will go over the role of environmental services, EVS staff in infection control and prevention, cleaning your hands and glove use, daily cleaning and disinfection best practices, product selection, key takeaways. Then we'll go over resources, references, end of session feedback, and then we'll have some time for our Q&A. So again, if you have questions, throw them in the Q&A box. We'll answer them at the end. Objectives for today's session are to understand the important role of EVS staff as part of infection prevention and control team. Know when to clean your hands. Know when and how to wear gloves effectively. Understand the decision-making process behind choosing the correct disinfectant for the task. And identify important information from product labels. So those are today's session objectives. And like I said, then next Thursday, or this coming Thursday, we will go over more of like cleaning process. Gives you a little idea what to expect. All right, so let's jump right into our content. The role of environmental services in infection prevention. So what is the role? Why are you here? Why is this important? Because consistent cleaning and disinfection practices can prevent germ transmission, right? And that's our goal in healthcare. Environmental services plays a central role in low and intermediate level disinfection, and cleaning and disinfection is a critical component of any infection prevention program. How can you do this? Here are some things that EVS technicians can do to stop the spread of germs. Cleaning and disinfection, wearing PPE, and these are in no order. They can ebb and flow which way. Adhering to signage, cleaning your hands, staying well and remaining up to date on your vaccinations yourself, and using EPA-registered disinfectants. So we do recognize that within environmental services, which sometimes is a challenge with environmental services programs, there are so many different roles and responsibilities that include people who you would identify as, actual EVS staff versus leadership. You have your kind of like frontline staff, EVS staff doing the cleaning and disinfection, but then you also have nurses, CNAs playing different roles, maybe in charge of cleaning different things. So it isn't just one set group of people. We all kind of play a role within this EVS environmental services cleaning program. So first we have, our EVS staff. They're organized and systemic cleaning and disinfection is like, your main goal here. And then you have you'll also be doing appropriate product selection, understanding and adhering to policies and procedures, and hand hygiene. So those are kind of like some of the main responsibilities of EVS staff. Then you have EVS housekeeping leadership, which they should serve as subject matter experts to all of their staff, take part in product selection, product expiration, storage, appropriate supplies. They oversee checklists. They set clear staff responsibilities, designate clean and dirty areas. They do audits and conduct trainings as needed or refreshers. And then you have Facility administration, which sometimes you don't really think like administration is part of an EVS role. However, they are key in product purchasing. They're supplying the money, training coordination, policy implementation, and designation of that EVS leadership. So there's some roles in there. And then, like I mentioned before, you have nurses, you have CNAs, you have staff that just help with transport, and everyone plays their kind of own role in cleaning and disinfecting certain things within the facility. So there was a study performed by Mary Kay Hayden in 2008 that aimed to estimate the level of contamination with the germ vancomycin-resistant enterococci, also known as VRE. So among the healthcare workers who touched a patient with VRE and/or their environment. First, I'm just going to throw some of the findings of the study at you. So after touching the patient and environment, 75% of ungloved healthcare workers and 9% of gloved healthcare workers' hands were contaminated with VRE. After touching only the environment, 21% of the ungloved and 0% of the gloved healthcare workers' hands were contaminated. So it shows you the importance right there of glove use. VRE has been recovered from numerous environmental surfaces, including patient healthcare staff gowns, door handles, cabinets, floors, blood pressure cuffs, bed rails, urinals, bedpans, toilet seats, all the above, and has been known to survive on a countertop for up to 7 days. So if this doesn't stress the importance of EVS staff in infection prevention and your role and your policies that you follow as EVS staff, I don't know what does. You know, wearing gloves, hand hygiene, and making sure that you guys are on the front line, cleaning and disinfecting, making sure that people are not entering the hospital and getting secondary infections. So, if I haven't alluded to it already, the most effective method for preventing the spread of germs, any guesses what this may be? Hand hygiene. So we're going to start with hand hygiene. We can't really delve into cleaning and disinfection without mentioning hand hygiene. So clean hands are the single most important factor in preventing the spread of germs, pathogens, and antibiotic resistance in healthcare settings, no matter what your job title is. CDC estimates that each year, nearly 2 million patients in the United States get an infection in hospitals, and about 90,000 of these patients die as a result of their infection. Coming in to get help, then getting an infection, and then passing away, which is unfortunate. So let's test some of our hand hygiene knowledge. On average, healthcare providers perform hand hygiene less than half of the times that they should. Do you think this is true, or do you think this is false? All right. So 100% of you said true. And that is correct. On average, healthcare providers perform hand hygiene less than half the times that they should. When healthcare providers do not perform hand hygiene 100% of the time, they put themselves and their patients at risk for serious infections. So whether you're performing hands-on clinical care, you're a licensed provider, you're a volunteer, or you work in environmental services, hand hygiene should be performed during the workday. And we will go over specifics in the next few slides of when to perform hand hygiene or cleaning your hands. And gloves do not serve as a substitution for hand hygiene. All right. So how can you protect yourselves and others? By hand hygiene, washing your hands. So you're going to clean your hands with an alcohol-based hand sanitizer or soap and water. Clean your hands before and after cleaning each room and other patient care areas. Clean your hands after removing gloves always, because again, gloves are not a substitution for hand hygiene. Clean your hands after touching items in the patient area. Clean your hands after you use the restroom. Clean your hands before and after you eat. And clean your hands before you go home at the end of the night. And this is just a basic when to clean your hands. But if you feel as though your hands are contaminated, wash them. It does not hurt to wash your hands more frequently than not. So 2 ways I mentioned for cleaning your hands, either with an alcohol-based hand sanitizer or soap and water. So specifics for cleaning your hands with an alcohol-based hand sanitizer. We're excluding scrubbing into an operating room here, just because that can get a little bit more in depth than we want to go. But alcohol-based hand sanitizer is more effective and less drying than soap and water in most cases. So we typically recommend alcohol-based hand sanitizer, and then we'll go over the exceptions. So to clean your hands with alcohol-based hand sanitizer, you'll put the product on your hands, rub your hands together. You'll cover all surfaces until your hands feel dry. And this should take around 20 seconds, about. So make sure you're covering all surfaces, nails, rubbing, all of that stuff. You can use alcohol-based hand sanitizer immediately before you're touching a patient, before performing an aseptic task or handling invasive medical devices, after glove removal, after touching a patient or the patient's environment, and after contact with blood and body fluids or contaminated surfaces, as long as your hands aren't visibly soiled. A lot of times hospitals have like a foam in, foam out rule. So if before you're going into a room, you may want to use alcohol-based hand sanitizer before you even introduce yourself to the environment. And then we have cleaning your hands with soap and water. So again, in healthcare, it's recommended to use an alcohol-based hand sanitizer to perform hand hygiene, except when hand washing is indicated. And the times when hand washing is indicated is after caring for a patient with C. diff or spores or other infectious diarrhea, when your hands are visibly soiled, before eating, and after using the restroom. To wash your hands with soap and water, you wet your hands with warm water and use liquid soap if possible. You're going to rub your hands together until the soap forms a lather, and then rub all over the tops of your hands. Make sure you're getting in between your fingers, around your thumbs, under your fingernails, all of the places, up into your wrists. Continue rubbing your hands for at least 15 seconds. Then you're going to rinse your hands well under the running water, and hopefully there's paper towels. You'll dry your hands with paper towels, turn off the faucet with the paper towel, and open the door with the paper towel if possible. It's preferred, instead of washing your hands, getting them nice and clean, and then touching a dirty handle. So gloves. Gloves were something else that CPFT saw some room for improvement with. As far as wearing gloves for longer than the extended recommended time, or not washing your hands after wearing gloves. So we're going to talk about glove use a little bit. Glove use reduces the risk of healthcare workers acquiring infections from patients, prevents transmission from environmental surfaces, and reduces contamination of hands of healthcare facility staff that can be transmitted to other patients and other staff. To be effective, gloves must be worn at appropriate times, though, changed when necessary, and removal must always be followed by cleaning your hands. So gloves should be worn when staff have contact with blood or body fluids, or anticipate contact, when contact with unknown fluids or body fluids is anticipated, and when cleaning and disinfectant labels indicate the need for gloves to protect your hands from those harsh chemicals. Gloves are not a substitution for hand hygiene, again, and hand hygiene with soap and water or an alcohol-based hand sanitizer should be performed always after removing your gloves. Gloves should not be used for multiple patients or patient environments. So 2 different patient rooms, or if you have 1 patient room separated by a curtain, 2 patients on, a patient on either side. Once you are done with 1 area and 1 patient, changing gloves appropriately during that time, you would then have to take your gloves off, wash your hands to start that new patient environment. You don't want to be bringing any old germs from one environment to another. Also, if you're moving from a patient room to a waiting area, you don't want to bring the germs from one place to another. So every individual environment needs their own set of gloves, and then clean and dirty, how you're working with the gloves in there, that will also change. You can be rotating your gloves in that room as well, individually, but making sure that they're separate for 2 patient environments. Gloves should never be washed or reused. They should be thrown out after use. And if they're suspected to be soiled, they should be removed, and hand hygiene should be performed right away. So here we just have a helpful poster of the do's and don'ts of glove wear, which we basically just went over all of the do's and don'ts in the last slide. So again, single use, wear gloves when you're anticipating touching germs, chemicals, blood, body fluids. Make sure you wash your hands. You can use thicker, and it mentions this on this poster, utility gloves. Those are available for reuse, but just make sure that you know how to use them. You're working with your supervisor. But we're mostly talking here about the single disposable gloves to protect yourself from any sort of infectious materials and, your hands from spreading germs. So most of this applies to the non-reusable. Don't wear gloves that are damaged or torn. Don't leave the work area with dirty gloves. Don't wash or dispose. Don't forget to clean your hands afterwards. Don't wear the same gloves in more than one room or space, and don't touch your hair, face, phone, or other personal items with gloves on. You'd just be moving germs from your gloves to the personal item, to your face, other places. So as I mentioned before, an important aspect of glove wear, appropriate or inappropriate glove wear, is removing them. If you're not removing them appropriately, then you can dirty your hands in the process, and then you've kind of crossed out using your gloves altogether. So to remove gloves, you'll have gloves on each hand. They always come in sets. To remove them, you'll reach for the top of the glove at the wrist. You don't want to touch your skin because that would be contaminating your skin underneath the gloves, but you'll grab the top of the glove, peel it away from your body, pulling it from the inside out, so it'll start turning as you pull it out, and hold the glove that you just removed in your opposite hand. Then you're going to reach in with your not clean hand, it was underneath the glove, but you don't want to reach the dirty part of the glove. You're going to reach in with your hand and flip that glove over. So you're touching the part that was touching your skin. Flip that glove over so the outside, more dirty part of the glove is not touching your hands as you're pulling it out. You're going to turn the glove inside out while pulling it away from your body, leaving the first glove inside the second glove, and then you have a little bundle of gloves. Throw that in the trash, and then you're going to clean your hands immediately after removing them. It is important to note, too, it's never recommended to double glove. So even if you're told you should wear double gloves, that's more protection, it's never recommended. The gloves could rub and then cause holes. There's no approved method for actually taking off double gloves. That's just kind of a theory people may have, but it's never recommended by CDC to double glove. So we're going to shift a little bit from hands to cleaning and disinfecting products. So an important part of effective cleaning and disinfection is selecting a product that is right for the task. Typically, EVS or housekeeping staff who are doing the cleaning are choosing a product from a selection of disinfectants that the facility provides. So the user would first want to make sure to use an EPA-registered product, and then would want to consider certain characteristics prior to choosing a disinfectant. So as a user, just thinking about this, you don't have to put in the chat, but what would influence your product selection when you're cleaning and disinfecting? So I have in yellow highlighted some of the characteristics of a disinfectant that a kind of like end user EVS staff would consider when selecting their disinfectant. So, you want to make sure that it's fast acting, right? Making sure you're using it in the appropriate place. You wouldn't want to use, for instance, a product that has a 30-minute dry time on a children's ward, for example. You want to make sure it's not toxic, same thing. You want to make sure it's pretty easy to use, simple to use, you know how to use it. It's broad, it kills for the germ that you need it to kill for. You also want to consider if you need to use it as a cleaner first, because sometimes you need to clean before you disinfect. And some disinfectants have both properties, but you have to make sure you know how to use each one. And surface compatibility, right? Like if you're using a rug, you can't use bleach. So there's certain things that you want to consider. Things you probably wouldn't consider as EVS staff, who are, frontline, would be like the cost of a product. That's more like administrative thoughts about a disinfectant. All right, so let's discuss a little bit. Here you can just kind of freely put your answers in the chat, and we'll kind of go through some of them. But a patient was diagnosed with norovirus and has vomited on the floor in their room. So you go into the room, you see that this happens. Now you're thinking in your head, all right, what am I going to clean with? What am I going to disinfect with? What characteristics, not exactly what disinfectant, because I don't expect you to know off the top of your head, but what characteristics are you looking for in a disinfectant to help you clean this room? It looks like fast acting. Yeah, anything like in a patient area where they're going to be there for a while, they're not leaving the room, and or if they were, like, you needed a quick turnover, you want to use something fast acting. You don't want to use something that you have to apply multiple times. Antibacterial. So I think that maybe that's getting at, you want to make sure it's effective against norovirus. You want to make sure it's EPA approved to actually, make sure that it actually does kill for the germ, for norovirus, which is known to be a very kind of tricky germ to kill in hospitals, and it's very infectious. You want to make sure you know how to use the disinfectant. You want to make sure that, does there need to be cleaning before disinfection? Yeah, you have to clean the vomit first, and then you would have to disinfect. So making sure, if it's a 2-step process or a 1-step process, that you know the process. Surface compatibility, we mentioned a little bit. So, what are you cleaning? You're cleaning the floor in this instance. It's in a bedroom, in a ward somewhere. So hopefully it would be a floor that's easy to clean, not a rugged floor. But I feel like I've seen it all. So making sure you're checking surface compatibility. You might want to consider toxicity if this is something you use all the time. So lots of characteristics to consider when you yourself are cleaning and disinfecting. So we certainly can't speak of effective cleaning and disinfection without the mention of contact time. And I've mentioned it a little bit as we've gone along: dry time, contact time. Contact time is the length of time that the surface has to stay wet with a disinfectant to kill the germs. So some think it's the amount of time it must remain undisturbed, which is true. However, if the product does dry in less than the recommended contact time, it has to be reapplied. So say, for instance, bleach, just an example, has a 10-minute dry time, and I'm just pulling this off the top of my head. That means that the surface has to remain wet with bleach for 10 minutes until that has been known to actually disinfect and take care of the germ. So again, if it dries, it needs to be reapplied because it needs to remain wet for that whole time. So in addition to knowing the contact time for the EPA registered disinfectant that you are using, you also need to know what germs the disinfectant kills and what surfaces it can be used on. So again, on Thursday during part 2 webinar, we'll go over how to look up a product on the EPA website if you haven't done so already, or if you're interested in figuring that out. So we'll go into that in a little bit more detail. All right, so CDC has this saying that the label is law. And anytime a product is being used, the user should be familiar with the key parts of a label. Labels include necessary and important information like directions for use, contact time, PPE that should be worn to protect yourself, protect others, first aid in case there is a spill or accidentally enters mucous membranes, and how to store and dispose of this disinfectant. So if the product has been placed into a new bottle, perhaps it has been diluted and stored for later use, it should still indicate what's in the bottle, and key label information should be available to staff who use the product. So there's no reason to not know what's in a bottle. It should still say important things that you need to know, or staff should know where to look it up. If, for instance, again, I'll just use bleach. If a bottle says bleach on it and doesn't have a label, then staff should know where to go to look up everything they need for bleach. To recap some of today's concepts regarding product safety, be sure that you follow the label, including wearing appropriate PPE to protect yourselves and personally advocate for yourselves if you do not feel as though you have appropriate training with your facility's cleaning and disinfection products. Again, in our Thursday session, part 2, we'll dive into effective cleaning and disinfection programs that include staff trainings and staff protocols, policies, things like that. Our key takeaways for today: all EVS staff play a critical role in infection prevention and control. The most effective method for preventing the spread of infection is cleaning your hands. Gloves are not a substitute for cleaning your hands. Choose the cleaner and disinfectant that is effective for the pathogen or germ and right for the task. Know the contact time for the product that you're using. Contact time is the time a product must remain untouched on the surface before it is disturbed in order to do its job. It must remain wet. And the label is the law. So before using a product, be familiar with the product and the product label. And if you aren't familiar with it, then that's where you go to your supervisor and you would ask them for additional training or assistance. And if you can't get that, then it probably shouldn't be a product that you're using. So again, I just want to quickly reiterate our certificate of training steps to be sure for those who are looking to get continuing education, have all the resources that you need. So please reach out to our team if you have any difficulty with these steps. We would certainly be happy to help you with them. So step 1, pre-session survey, that should be already completed before the session started. And then you participate in this session, check. There's a post-session survey that will be emailed to you tomorrow, August 27th. That closes September 2nd. And again, remember that the post-session quiz is required for CNEs, and it's optional for others like dental or EMS. And then the certificate will be emailed to you September 5th, 2024. If you don't get it, email us. If you have issues, email us. We're happy to help. So some of our resources include our Project Firstline Rhode Island website, where you can register for our upcoming webinars. You can sign up for Project Firstline Rhode Island emails, request trainings, or get updates for future trainings. Can connect with our team, reach out to us. We do have YouTube, X, formerly Twitter, Facebook, Instagram, and LinkedIn. You can follow us on all of our social medias. Again, we post some funny things. We post some, monthly C. diff month things. And we post our upcoming trainings, any important announcements we have for anybody. Those all get posted on our social media. So if you follow us, you will be joining us on our infection control journey. So just a quick plug for our future trainings. Again, I've mentioned it many times, but we have our part 2 on Thursday, cleaning disinfection, a deep dive for EVS personnel, part 2. I will be hosting that at noontime, and that'll be about an hour. And then September is exciting for us. September is microlearn month. So these microlearns, they are 15-minute courses that focus on providing just the need-to-know information about shows and topics. They're designed to be used in clinical discussion, potentially to address like during a huddle or a daily meeting, to teach you how to help staff feel more secure in knowing what to do in certain situations if they came across a patient with a rash or a draining wound. There was blood, or a patient with new cough and congestion, or if a patient with diarrhea. What are the key things that you need to know to protect yourselves and your patients? Really kind of like just down and dirty and really quick sessions. So join us this upcoming month for that series. Again, they're 15 minutes. They'll all be at noontime. We have a September 5th, 9th, 12th, 23rd, 26th. And that'll be presented by all of our liaisons, myself, Lisa, Steph, and Jacob. These are the references for today's session. If you need any of the references, if you have any questions, those will be on our post-training resources we'll send to you. We would like to thank you for attending today. If you could please fill out our quick feedback form, it'll pop up on your screen. We look at this to use the feedback to help us understand learning needs of our attendees, tailor future educational sessions to meet your needs. And if you have any questions or would like to be on our distribution list or would like to request sessions, you can visit our website or email us. Those are right on the screen in front of you. I'm going to leave the poll up for you to keep going, but I'm just going to quickly go to the end of session Q&A and just start taking a look at if there's any questions. So keep doing that poll. I don't see any questions. You do have, I'll wait like a minute, see if there's any questions coming in the poll box. This was pretty direct webinar. Again, Thursday, we're going to go over a lot more in-depth policies, procedures, how to move around a room to clean it, how to go from clean to dirty, instead of going backwards and like dirtying cleaner surfaces, high to low, things like that. So stay tuned. It's a really great session. And again, that's an hour long. So if we don't have any questions, I will close out here. I look forward to seeing you all on Thursday. And again, if anyone does want to join, if you have any colleagues that you want to bring in or have them join, they don't have needed to attend this first session to attend Thursday. We're welcome to having, repeat participants and or new participants. So again, look forward to seeing you Thursday at noon. And I will stop the webinar now. And again, thank you for joining us today. Take care.